Good afternoon, everyone. My name is Andrew Phelps, and I serve as the Director of the Oregon Office of Emergency Management. Joining me today is Pat Allen, Director of the Oregon Health Authority, and Fariborz Paskaresh, the Director of the Oregon Department of Human Services. We'd like to take this opportunity to provide an overview of the state's response to last month's record-setting heat and the steps we've taken to reduce our risk of future extreme weather events. I say this, of course, as our entire state is experiencing drought conditions. We have dozens of fires burning throughout Oregon, including the Bootleg Fire in Southern Oregon that has burned over 150,000 acres and destroyed several structures. While I've spoken directly with many of you one-on-one over the past few weeks, I wanted to make sure we could come together today and provide an opportunity for this collective briefing regarding the recent historic and tragic heat waves as the situation continues to develop. First, let me express my gratitude to our local emergency management partners, support agencies, and the Red Cross and volunteers who stood up dozens of cooling centers across the state, answered calls for assistance, and worked around the clock to respond to heat-related emergencies. These actions undoubtedly saved lives. I also want to acknowledge our partners at the National Weather Service. They provided several days' notice about the record-setting potential of this event, provided updates about where and when we could expect to experience the excessive heat, and shared tips and recommendations for keeping cool during the heat wave. Despite these efforts, however, dozens of Oregonians were not able to get the help they needed and tragically lost their lives. The state medical examiner reports at least 83 deaths attributed to the excessive heat. Please know my deepest sympathies lie with the families who have experienced this loss. As we review the actions of the state and local agencies and organizations, it's important to remember that events like the heat wave are locally driven and state supported. Our local partners know their communities, their resources, and their needs and are best positioned to respond. It's important, however, that the state maintains a level of readiness to support and coordinate our local partners should they need additional assistance or resources. Leading up to this heat event, we transitioned our state emergency coordination calls from the water system chlorine supply issue to heat-related planning and coordination. We joined our state, federal, and local partners in developing messaging and providing resources to help the public make decisions to protect themselves. We also had staff in contact with the impacted counties and monitoring for any requests for assistance throughout the heat wave event. Now, I've been asked a couple of times whether or not the governor should have declared a state of emergency. When I make a recommendation to the governor for an emergency declaration, generally it's because local resources have been or are in danger of being overwhelmed and state assistance is needed. This is typically in concert with a local emergency declaration. Or there are actions the state needs to take using the tools or resources only available through an emergency declaration, or rules that need to be waived in order to effect an appropriate emergency response from the state. We also utilize emergency declarations to request assistance from other states through the Emergency Management Assistance Compact. It's important to note none of these factors were present during the heat event. Now, as we look to complete a state-level review of the extreme heat event, it's important that we understand what happened, what we've learned, and what changes, both immediate and in the long term, are necessary to reduce our risk from these future climate-driven events. We need to move as quickly as we can to gain better understanding and be as proactive as possible in adjusting our response, now knowing there will likely be policy recommendations and necessary critical discussions for state and local governments to consider and to potentially adopt. Some of the things we expect to look at during this after-action review are the number, location, and accessibility of cooling centers and other resources, the speed and frequency with which health-related data is provided to emergency management and responders, how we communicate, or probably more accurately, how we think about risk. We tend to rely on our past experiences to plan for how we'll handle future situations. We've all experienced the impacts of smoke from wildfires, maybe flooding, but now we're experiencing historic flooding in places that didn't used to flood, and fire in places that didn't used to burn. These unprecedented ice storms and record-setting temperatures, these are things that none of us have experienced, and we have no muscle memory to rely on. So how we incorporate our changing climate and those impacts into developing our culture and preparedness is really important to our state. This means addressing what our communities need to adapt to high and low temperatures, and neighbors helping neighbors. This means checking in on that elderly couple across the street, or calling your coworker who you know doesn't have access to transportation, or reaching out to that relative who has a medical condition and may be more susceptible to the impacts of heat. This is for events like heat, but also for wildfire evacuations, power outages, or other bad days that Oregon may experience. And we know in the last 18 months, We've had a lot of those bad days. It's important to note that these events are not anomalies or outliers. They're indicators of what we continue to expect. It's no longer just about stopping or slowing the changing climate. It's about adapting to climate change. These events impact our state, our region, our economies, and our infrastructure, and our very lives. This is why these types of collaborative reviews are so important to ensure we're ready not for what happened yesterday, but for what will happen tomorrow. And with that, I'll pass it on to Director Allen.
Thanks, Director Phelps. Good afternoon. I'm Patrick Allen, Director of the Oregon Health Authority. The extreme heat conditions we experienced in Oregon last month seemed otherworldly. Oregon has seen triple digits before, but the notion that cities like Portland and Salem, or even typically warmer places like Medford and the Dalles, could get above 110 degrees, much less surpass 115 degrees, and do so only in late June, seems unthinkable. The reality is that such excessive and deadly conditions may be here to stay. In the last 5 years, Oregon has recorded its hottest years in state history, and unfortunately, this trend is expected to continue. Past climate models predicted more frequent and severe heat waves in our state, and events are bearing out those predictions. Heat waves occur from time to time as a result of natural variability, but human-caused climate change, mainly from the burning of fossil fuels, is contributing to the intensity of extreme weather events here and around the globe. There have been historically few places in Oregon that experience a substantial number of days over 90. Yet due to climate change, nearly the entire state will need to prepare for steady increases in extreme heat over the next few decades. So what are we doing about it? We know that these increases in temperatures will increase the number of heat-related deaths and hospitalizations. The Oregon State Medical Examiner, as Director Phelps noted, has reported 83 confirmed heat wave deaths as of July 9th, with an additional 32 deaths pending further investigation. At least 10% of the confirmed deaths were people of color. I want to express my sincerest condolences to the friends and family of those who lost their lives in this event. And according to our hospital surveillance database, there were more than 800 heat-related illness visits at Oregon emergency departments between June 24th and the 4th of July. Heat-related illness is preventable, but only when people have the means to protect themselves. And to help people protect themselves, they need information. To this end, OHA distributed a statewide media release that included information on how people could prevent heat-related illnesses that can lead to heat exhaustion and heat stroke, distributed an extreme heat risk communication toolkit in 11 languages, which was widely used by local public health and community partners, shared information on its website on how people can prevent heat-related illnesses, published 7 extreme heat protection messages on Facebook, reaching 286,000 people and shared more than 3,000 times. We produced daily statewide surveillance summary reports that tracked heat-related emergency department visits and ensured Oregon's coordinated care organizations had the flexibility to identify and provide health-related services, including items for the living environment not otherwise covered by Medicaid, such as air conditioners. Our data show that in this category of health-related services spending, CCOs spent more than $28,000 for 146 members during 2020. We also saw hospitals across Oregon facing high emergency medical services and emergency department volumes. Some facilities experienced power loss. To address this, regional hospital collaboratives convened to discuss and coordinate hospital capacity issues statewide. OHA also urged Oregonians to contact their primary care provider if they begin to experience non-emergency heat-related illnesses such as heat exhaustion, heat cramps, sunburn, heat rash, and the like, to reduce demand on the region's hospital emergency departments and beds. Our work continues for the next heat wave of 2021 and in years to come. The recent heat wave is part of an interconnected web of climate risks, including worsening drought conditions, increasing wildfires, and more flooding events. Governor Kate Brown's executive order on climate change included specific directives to the Oregon Health Authority to work with Oregon Occupational Safety and Health, Oregon OSHA, to propose new standards for protecting outdoor workers from extreme heat. Last week, OSHA enacted temporary rules to ensure urgent protection for workers from extreme heat. OHA's team will continue to work with OSHA on the adoption of permanent rules focused on worker safety from heat and extreme weather. We're also now publishing annual climate and health reports. OHA's Climate Change and Health in Oregon 2021 report will include more detailed analysis of the June heat wave, along with analysis of other climate-related events. The recently passed Healthy Homes and Wildfire bills will create new programs within OHA, that will help to ensure more Oregonians can safely take refuge during extreme weather events. Working with partners is key to planning for the future. We're currently modernizing our public health system and making foundational investments in environmental justice and health equity with a priority on climate. OHA helped to ensure that extreme heat was, for the first time, included in our state's 2020 Oregon Natural Hazard Mitigation Plan. And OHA has launched the next 5-year update of our Climate and Health Resilience Plan to recommend changes in systems and policy we need to protect Oregonians and support communities in their efforts to build climate and health resilience. Finally, because our summer's not over and more days of excessive heat are expected, we continue to encourage Oregonians to do what we're known for, taking care of our neighbors. Remember that older adults and young children are more susceptible to heat-related illnesses since they get dehydrated more quickly and their ability to cool themselves might be lower. People with chronic health conditions may be at higher risk. Those with mental illness may not be able to take steps to cool themselves, and those with poor blood circulation are sometimes. People who are overweight can also be at risk. Help these folks find and get to cool, air-conditioned public places and cooling centers when their homes get too hot. Encourage them to drink water before they become thirsty. Help them understand the warning signs of heat stroke, heat exhaustion, or complication of chronic illness that extreme heat might trigger. Now let me turn it over to Director Paksarash.
Thank you, Director Allen, and good afternoon, everyone. I'm Fairborse Paksarash, Director of Oregon Department of Human Services. Similar to our partners in Oregon Emergency Management and Oregon Health Authority, we were deeply saddened by the loss of lives during the extreme heat, and we express our condolences to their family and loved ones. While we did take proactive steps to help spread the word on the availability of resources, we also recognize there are lessons to be learned and will work with our partners to address those. Oregon Department of Human Services has specific and assigned roles during emergency or crisis. In addition to our regular responsibilities to the population we serve, we also have responsibility for supporting Oregonians by providing food, water, and shelter under the state's emergency management plan in our mass care role. Speaking specifically about the extreme heat, we acted in advance to support individuals in our care and the public at risk. During the week leading up to the heat wave, our staff contacted our providers about their emergency plans. They also contacted other agencies and community organizations to coordinate and prepare for the heat wave. They reminded our providers about their responsibilities, including keeping people cool and making sure air conditioning units were working. They identified individuals who may need assistance with extreme heat and made connections to get the people we serve water and ice packs, and in some cases, box fans when they were available. We notified home care workers and in-home care agencies that serve older adults and people with disabilities that they would be paid when taking a consumer to a cooling center. The Oregon Home Care Commission also sent out information, including text messages to home care workers, personal support workers, and in-home consumers of services. In our mass care role under the Oregon Emergency Management Plan, we provided information to our programs and reminded them on how to access mass care support for the people they serve. We made sure our vendors who supply meals to people in our emergency shelters had plenty of water in stock. We reached out to 211 to see if they would be a statewide information point for cooling center information and coordinated with local emergency managers on how to send their information to 211. We also use social media, specifically Facebook and Twitter, and shared details on where to get cooling center information. And we also encouraged people to submit cooling center information that we may not have been aware of to 211, things such as cooling center stood up by faith organizations. We encouraged people to check on their neighbors. During the high heat, our staff visited cooling centers and large houseless camps to assess the need for water in Clackamas, Marion, Multnomah, and Washington counties so we could provide water where it was needed. We worked with 211 to resolve issues on availability of cooling center information. Over the weekend, we found out that people were having difficulty finding the cooling center information when they called 211. Our staff called 211 and experienced the same thing as were being reported to us. I must point out that 211 is a valued and critical partner. Like many other organizations, Oregon Department of Human Services relies on 211 to provide critical and life-saving information about our services. We found out that 211 was not staffed during the weekend, so we asked what it would take to staff the center so people could get the information they needed. They told us they needed additional funding to staff the center. We then provided funding to staff phone lines 24/7 during the heat wave through 11 p.m. on July 5th. I would also say that we learned much during this response and are working with our partners to make improvements in two specific areas. First, assisting improving access to services through 211. We are pleased to learn that 211 moved its core services to 24/7 on July 10th. They're also making changes to their phone tree to be more intuitive, and they're putting more information about programs and operating hours online. Additionally, Oregon legislature provided $3 million in funding to 211 to expand service capacity and emergency planning and response. That funding was provided during the 2021 legislative session. Second, we are working to improve and develop shelter-in-place strategies for those Oregonians who are unable to leave their home during an emergency due to medical or other limitations, such as significant transportation issues. For that population, often their needs are better served at home. Therefore, we need to look for a shelter-in-place strategy to help them stay safe. We are collaborating with Oregon Health Authority on that strategy. Finally, reiterating what was stated already by Director Phelps and Director Allen, we also need to help people and communities help themselves and one another. We all have responsibility for our own safety, but sometimes we need the help to know what to do. Neighbors, friends, and family can also assume roles and responsibilities to support one another. We intend for our shelter-in-place strategy to include a strong public awareness element to help Oregonians help one another. I'll stop there and turn it over to Ms. Doan from Oregon Emergency Management to start Q&A.